So what about ophthalmology in donkeys? As I told you, a real separated discipline doesn't exist in donkeys, and we have to establish. If you look for donkey ophthalmology for ophthalmologic situation in the most popular research engine, you can find some case reports like this one. Most of them came from Africa or from Europe, in some instances from UK, of course, and also for US. And so you can find several, not so much, but some case reports about ophthalmology in donkeys. You can see Setaria equina as always particular situation. Or you can find, this is interesting, eosinophilic paraconjunctivitis is very, very easy to find this disease in horses. This is the first report in donkeys. This is coloboma in donkeys. And not only about the globe, but also about the adnexa of the eye, you can find some report. The real research are not so much. You can find some anatomical and physiological research. This is about nasolacrimal duct in donkeys. We know it's different from horses. In horses, there are different, and conjunctival fungal flora in healthy donkeys, we also did this kind of research, and about bacteria. And this is very recent. This is a few months ago, and this is the kind of research I think we need. So physiological evaluation of the pressure. We didn't know the pressure for example, for glaucoma or for uveitis. We can measure the pressure in donkeys, but we didn't have the range. Now we have it in donkeys and in miniature donkeys. This is very important, I think. And this is the professional handbook of donkey, of course, you know. And you can find a chapter about the condition of the eye. So that's all we have for donkey ophthalmology until now. So this is our research about electroretinography in donkeys. So we are making comparison between donkey and horses. In this case, we didn't find so many differences in the graphs that we obtained. It's to evaluate the function of the retina. Conjunctival bacterial fungal flora, we did also this kind of research, and we found, interestingly, that the most important difference is the area where the donkey lives. And you can find different kind of bacteria and different kind of fungus. It depends not from the gender, not for the age, but it depends from the area you took the samples. So ultrasonographic evaluation, biometry in the eye of donkeys was never done, and we did it in donkeys, and we found so we found the range for the several measurements for the globe, for the lens, and for the vitreal chamber, for the anterior chamber, and we also found that the size of the lens is like in human. It doesn't depend from the size of the donkeys, but it depends from the age of the donkeys, because the lens grow up during all the life of the donkey, as in human happen, and this is important from the clinical point of view, because if you have to make surgery for cataract and somebody use this artificial lens to put instead of the OPBA child's lens, and it's important to know this. And another important difference is that in horses, you can look in the back of the eye, in the retrobulbar space. You can have some mass, you can have some blood after trauma, and you can check it by the ultrasound machine. You can do it in donkeys, in horses, and you have to put the probe in this position, and you can look behind the eye. This is very easy to do in horses, and as you can see, you have not the structure of the eye, you have not the lens, you have not the iris, because you are just looking behind the eye, and you can see the fact, the retrobulbar space, and this is the optical nerve here. We see some picture. In donkeys, this is not possible in most of the donkeys because of the bone, the frontal bone. It's not possible to put the probe in this way, and it's not when you try to avoid the lens, the iris, and the anterior chamber, you are not able to do it because you cannot enough up to avoid this structure. So when you compare the picture, you can see in donkeys you have the retrobulbar space. This is the fat, and this is the optical nerve, and you can see the optical nerve with this shape, this round shape, because it's cut in this way by the ultrasound. In donkeys, you can still see the cornea, the anterior part of the lens, the ciliary body, the iris, and the retina. And this is the optical nerve, because you cut the optical nerve in this way, in the longitudinal way. So it's not a round stuff, but it's something like a strip. So be careful when you try to make diagnosis of retrobulbar space disease in donkeys, because you cannot have the perfect image because of this. So that's why you have this is a horse skull, this is the frontal bone, this is the zygomatic process, the zygomatic arch, and this is the lacrimal bone, this is the zygomatic bone, and the temporal bone. They are forming the orbital, and you can see here. When you compare the horse skull and the donkey skull, you can see you have this is the orbital, this is the upper edge, and you can see the upper edge of donkeys. This part is in the horse normally medial in respect to the lower part. In donkeys can be the reverse. Also the border is more linear in horses than in donkeys. So that's why when you visit an horse, it's very easy to check for mucous membrane, but if you want to do it in mule or in donkeys, it's a little bit more difficult because you have this bone, and also because you have stronger anatomical differences in the palpebral muscles. In mules and in donkeys, they are stronger, and it's difficult just with a finger to open the eye. And so this is what you can do in horses. It's very easy. In mule, it's a little bit more difficult. You can do it, but so you can see the stronger eye. And in donkeys, your finger go inside. So it's very difficult to try to open it. So this is not just to visit the donkeys, but it's just to put the drug inside and to make a real good eye examination.